Hi, I'm Peterson, and I'm student number 1, and I'm going to start off with a rotary push on a left rotation restriction. My contact point is going to be my left pisiform. My segmental contact point is going to be the posterior inferior aspect of the right TVP. My stabilization point is going to be my right pisiform. My segmental stabilization point is going to be the posterior inferior aspect of the left TVP, and my line of drive is going to be P to A, I to S, parallel to the 60-degree angle of the facets with counterclockwise torque, and I'm going to start at 10 and 1, go to 12 and 9, and end at 11 and 8. And I'm going to be doing it at T6.
Segmental contact point will be the posterior aspect of the articular pillar.
So on this one, his
My stabilization point is going to be the
Okay, for my second adjustment, I'm going to be doing a prone index pillar push contralateral for a left rotation restriction. My contact point is going to be the lateral aspect of my right index finger. My segmental contact point is going to be the posterior aspect of the right articular pillar. My stabilization point is going to be the thenar of my left hand with traction cephalad, and my stabilization segment point is going to be the left mastoid and posterior inferior occipital rim. And my line of drive is going to be P to A in line with the plane of the disc with my forearm at a 45-degree angle. And I'm going to be doing it at C4. Can I have you look towards me, please? For my next adjustment, I'm going to be doing a supine hypothenar mastoid push ipsilateral for an RPS. My contact point is going to be the hypothenar of my right hand. My segmental contact point is going to be the posterior inferior aspect of the right mastoid. My stabilization point is going to be the calcaneal aspect and digits of my left hand. My stabilization segmental point is going to be cradling the base of the occiput on the left side, and my line of drive is going to be P to A, S to I, right to left. For my next listing, I'm going to be doing a seated anterior thoracic with the listing of an AI. My contact point is going to be my hypothenar and thenar and the distal phalangeal joints of digits 2 through 5 of my superior hands. My segmental contact point is going to be the posterior inferior aspects of the right and left TVPs and of the segment immediately below. My stabilization point is going to be the calcaneal aspect of my inferior hand, and my segmental stabilization point is going to be the upper elbow with a line of drive of A to P, I to S. I'm going to be doing segment T5. Can I have you tilt your head in and take a deep breath? And blow it out. Okay, for my last adjustment, I'm going to be doing a seated digit TVP pull contralateral for a left rotation restriction. My contact point is going to be my left pip and dip of my middle finger. My segmental contact point is going to be the right posterior TVP of C1. My stabilization point is going to be the calcaneal aspect of my right hand, and my segmental stabilization point is going to be the inferior tip of the left mastoid, and I'm going to use slight I to S traction. And my line of drive is going to be P to A, slight I to S with counterclockwise torque. Yeah.